Okay, so hi everyone. My name is Dr. Roy here at Refine MD. This is Christine Romero.
Hello.
Who has multiple hats in this practice, but as it relates to the surgical division here, she is a patient care coordinator. So she is like the first person that patients interact with when they initially want to schedule a consultation with me. She'll kind of walk them through the process in terms of scheduling that consultation. We'll go over some of the pertinent information that people want to know after they've talked to me, like price and availability and scheduling and all that kind of stuff. And she's also a great asset to patients after surgery, also as a clinical and administrative support person for them. And so we figured we'd come up with a video series that we basically just came up with that we thought might help either prospective patients, current patients, one, to get to know us, two, to maybe cover a few of the common questions that she and I get, me in the consultation, she throughout the whole, consultation process. And hopefully through that process, you'll get to know us, you'll get to know some of the, common things that maybe you should be asking your surgeon when you're going out to get a consultation, or me. And we'll go from there. And we'll keep it organic, so we'll try and do this as frequently as we can based on real questions that we're getting from the previous week's consults,
Yeah,
or
I love that.
from communication, right?
Perfect.
What else, Christine?
Yeah, I think in general, this is an opportunity for you guys to get to know us and to kind of get a good idea of what things we have that do come up during a consultation. So that way it gives you more questions to be able to think about also prior to your consultation, but just know that you get much more information when you come in to actually meet us.
That's right. So we will start off with just two questions, maybe. So I'll think of a question that maybe I get, and or that I got recently, and then maybe Christine, you can cover something that you recently had a patient ask you.
Perfect.
Sounds good.
Perfect.
So just earlier today, I had a patient come in. She was in her early 40s. Keep it vague. Very early 40s. And she basically came in and she basically said, I've been doing things that, I feel like people my age would be doing at this point, like neuromodulators, Botox, some fillers in targeted areas. And she was also doing collagen stimulating injectables, which is great for somebody that early to start working on their skin and building collagen. But she also wanted to kind of find out whether she might be a candidate for surgery. So, when she would pull her face back, she felt like, if only it was up here, I just feel like that would just be it. Because over the last year, just very suddenly, I've noticed that things have fallen, right? And we get that a lot.
All the time.
It's like I wake up one day and my face is different. So basically she was asking me if as a early 40-year-old, having had whatever procedure she did, whether I thought she was a good candidate for surgery. And I'll always start off by saying, Refine MD is a very special place. We're not only a facial plastic surgery office, but we also a full spectrum cosmetic dermatology practice. So we have, a wide spectrum of devices, both heat-based skin tightening devices, lasers, microneedling devices with radio frequencies. So it's not like we have only one option to offer patients, or a very isolated device that, hey, look, we're going to try and do everything with this one particular device. We have a lot of things. Mm-hmm. And we have Dr. Spangle's expertise and his whole, extenders and all the nurse practitioners and nurses that work with us.
Which is very unique.
Which is very unique.
Very unique.
Yeah, right? So the fact that you come in and you're getting, really the truth. Like, we want to make sure that you're getting the option that works for you, right? And so what I told her was that although I think that, most people could probably benefit from surgery, and some people, I think some plastic surgeons are a little bit more aggressive in recommending surgery versus others that maybe just, at a certain point, early 40s, probably not, maybe stick to the non-surgical side first and then maybe see me down the line.
Right.
But I told her that, look, I think for certain things, surgery can help, but the change is not as dramatic, right? And so if you're looking for small improvements, I don't know if going through a deep plane facelift or something like that is going to give you that much that much improvement to justify maybe some of the downtime that just increase and the cost and all that, right?
Right.
So I was trying to talk to her a little bit about the options that we have here, and I went, and the nice thing is because I know about those things, I turned it into almost like a non-surgical consult, where we talked about heat-based devices, microneedling with greater frequency, PRF under eye injections that we've been doing to improve, tone and texture of the eyelid. But I also did talk to her about a mini facelift and a lateral brow lift and a little partial fat transfer, because she was really looking to get long-term solutions. And it's not that we'll discount you for surgery, that'll always be an option on the table, but we just want to make sure that patients have realistic expectations.
Well, and I think on top of that, I find that a lot of patients at some point will get to a point where either they're frustrated that non-surgical options aren't working for them anymore, so they want something a little bit more permanent, or they feel like they've been doing certain things and they're not getting that full effect or that full result that they really want. They're getting some improvement, but they're not getting the full improvement. So I think that's where a lot of patients end up kind of tiptoeing on, going from non-surgical to surgical in order to get more of a permanent result.
Yeah. And then the one thing that I'll always say, and I was in surgery yesterday pretty much all day, and I had this visiting surgeon from Australia who we were just talking about some of the changes that we see as facelift surgeons with patients that have undergone all these other treatments like threads and all therapy, and not to say that those aren't great, and we'll continue seeing this trend where people are going from the non-surgical world to the surgical world. So as surgeons, we have to be prepared to see all of it,
right?
And know that we can still succeed in the surgeries that we do, despite all this other treatment that patients have gotten that may have affected some of the tissue planes and the quality of the skin. But I'd say that I think that the beauty is we want to present it to you in like digestible chunks. So, for people in their early 30s who have a very busy lifestyle, maybe are constantly being seen at work, maybe surgery is not always the right answer, and maybe we can offer you a solution that minimizes downtime, but still gives you, good results that you can see, that you can appreciate, without the sort of pain, downtime, scarring that may be associated with surgery. Because, again, once you do surgery, there's really no going back. Right?
Yeah.
And so it's an important conversation that we like to have. And Christine, I think, oftentimes will also discuss non-surgical alternatives with patients.
Absolutely.
Right?
Yeah. I mean, I find that it's good to know that, kind of to your point, that there isn't just one option. And it really depends on what the patient's looking for and what their main results are. So if they're looking for minimal improvement, sometimes that is the best option. And I would say we're definitely not a team that pushes people into one way or the other. I think we like to present the options on what would be best and allow them, with all the information, choose which option they prefer, right? And what works for timing, lifestyle, all of that.
Right.
And so I find that we've been really successful in being able to do that, because I think patients feel more confident and comfortable that it's not just trying to go just surgery and that's it, but being able to open up more opportunity for what they can do and what options there are and allow them to make that decision.
Right. So just remember, I guess as a team, our goal is to build trust, build your trust, take care of you in an exceptional fashion, give you the results that you're looking for. It might take time, but we're there, and we have the means and the resources to be able to take you through this journey, because it's always a journey.
Yeah.
And so hopefully this video series is helpful. Thank you, Christine, for joining me on these. Hopefully we'll be able to include you on more of these. And if you have any specific questions that you would like to answer or you'd like us to answer, please do share it in the comments section, and we'll do the best we can.
Yes.
So thank you, and have a great day.
Bye.